Good evening, everyone. Welcome to this One Georgia virtual town hall. This is, I think, our 32nd town hall during this campaign. But this is an extra special event because I am joined by my favorite person in the whole world, my best friend, my wife, the amazing Dr. Alisha Kramer, OBGYN, who is my hero and my role model and my guide. And we're going to talk about healthcare, because Alisha is on the front lines here in Georgia and has been taking care of patients throughout this COVID-19 pandemic. And we want to hear your questions about our healthcare system, about the future of healthcare policy, and get to know you a bit better. So as always, for these town halls, remember, you can throw your questions into the comments, into the replies. We're streaming on multiple platforms. Apologies in advance that we won't be able to get to everybody, but we'll do our best to answer your questions. And I just want to open things up by letting you know a few things about Alisha. So first of all, we're doing this right now. Alisha worked an overnight shift last night in labor and delivery here in Atlanta. And throughout this campaign, it's been interesting that, people always ask me how I'm doing. And I'm like, I'm fine. Alisha is on her feet all night delivering babies. She's the one that you need to check in on. But Alisha, how has it been in the hospital the last few weeks?
Yeah, it's busy as usual. We run very, very busy labor and delivery services here in Atlanta. And of course, I think everyone feels a little bit more heightened, just feeling like a second wave is coming of COVID-19. But otherwise, we've kind of adopted a new normal, wearing masks all the time, wearing eye protection, and trying to help women through this difficult process during a very difficult time.
One of the things that's been amazing is I've gotten to know a lot of Alisha's colleagues, other young doctors who are working these very long hours and who had to adapt during this crisis. And, you didn't have all the information or frankly, all the support that you deserved from our own government at the beginning of this. But the medical professionals have been the real heroes. Politicians haven't been doing their jobs, but doctors and nurses have. And I love you and I'm proud of you for all that you've done. So we're going to start off with some questions and take it away.
Yeah, so our first question is from Anne from Marietta, who wants to know, what can we expect to happen with healthcare for all in the new year, whoever wins?
Well, there's a few things going on right now I think worth talking about. So first of all, we need to talk about pandemic response. And it's been clear since the spring what we need our political leaders to do. That's to empower people like Alisha, medical experts who actually know what they're doing, public health professionals, epidemiologists. One of the reasons that the United States has seen this pandemic spiral so out of control, which is also deepened the economic crisis, is that foolish politicians like the president and like Senator Perdue politicize the response instead of empowering and trusting the experts. And when we win these elections and we have a new administration and a new Senate, we will be empowering healthcare professionals to lead on the healthcare response. We will be providing open, honest, and direct best practices and advice to the people, not trying to cover up what's going on, not downplaying this deadly pandemic and comparing it to the flu, but leveling with the people we represent about the threats to our health and how we can protect ourselves and our families. All of the mixed messages that were sent about PPE and mask wearing, all of the efforts to distract attention from this crisis have undermined our ability to respond to it. Then we need to talk more broadly about healthcare policy. And there's a really clear contrast between me and my opponent on this. My opponent, Senator David Perdue, who has become significantly more infamous in the last 4 days for his bigoted mockery of Senator Kamala Harris at a Trump rally in Macon. Senator Perdue, even in the middle of this pandemic, is pushing to repeal protections for people with pre-existing conditions, trying to take us back to a time when insurance companies can deny health coverage to people who have diabetes or cancer survivors, asthma, COVID-19 survivors. And that's because of the political power of the insurance industry. The insurance industry has purchased the allegiance of politicians like David Perdue, and that's why even during a pandemic, they're trying to undermine healthcare protections. Another major point of contrast, Senator David Perdue opposes Medicaid expansion. So Georgia is one of very few states that has refused to accept federal Medicaid dollars that came with the Affordable Care Act. And that means that our hospitals have been denied vital resources. And it means that especially low-income families here in Georgia haven't gotten help that they could get to afford their health care. It also means that chronic illnesses like asthma and diabetes, high blood pressure, which make individuals more susceptible to something like COVID-19, have not been treated as well as they could. And maybe, Alisha, you could tell us a little bit about the kinds of chronic disease that we see among people here in Georgia and how we can do a better job of preventing and treating it.
Yeah, so I think you really hit on some of the big ones. So hypertension, diabetes, cardiovascular disease affect many Georgians, and especially a lot of our women and our pregnant women, and can cause some serious morbidity during pregnancy and throughout the course of an individual's life. And these are preventable, largely preventable. And having good access to preventative care early on in life is important and key to keeping our population healthy, keeping our women healthy. Because once we do that, our families can be healthy and our state can be more prosperous.
So thank you, Anne, for the question. And we have another question.
Yeah, so Candace from Stone Mountain is wondering, how do you plan on combating this pandemic that is taking hundreds of thousands of lives with a Republican governor that is not taking this as serious? How do you take politics out of the equation?
So I think, Candace, that covered some of this ground in the response to the last question, but it is about taking the politics out of this. This is a public health emergency, but it's been treated like a political crisis. Our governor has gone even further, and he's treated it like it's a political opportunity, right? He went out of his way during this pandemic, not to promote best practices, not to empower local authorities to, for example, require masks in public buildings and bars and restaurants and grocery stores to slow the spread of the virus. Instead, remember, he was suing the mayor of Atlanta to try to undermine her effort to promote public health, to require masks in public places. One of the things that I think gets lost in a lot of a discussion about, for example, mask wearing, is that it's not just about protecting yourself. In fact, wearing a mask is about protecting others. It's so that if we are infected, we do not spread the disease to other people that we come into close contact with. And so the bottom line, Candace, is that we need political leaders who will follow the advice of medical experts. Here in Georgia, we have the Centers for Disease Control and Prevention, the CDC. By the way, Senator Perdue voted to cut $1 billion from the CDC budget, right? The agency that fights pandemics. And the career experts, the public servants who know what they're doing at the CDC, who have dedicated their careers and their training and their lives to fighting deadly outbreaks of disease, they've been marginalized. Their voices have been suppressed because the Trump administration politicized the response, and folks like David Perdue allowed them to. And so we need to get back to a time, Candace, when political leaders will empower experts to lead in a crisis like this.
All right. We now have a question from Facebook Live. Randy asks, what is your plan to protect Roe v. Wade in a state like Georgia if the Supreme Court overturns the ruling?
Well, first of all, Randy, I mean, we're seeing right now with the Supreme Court battle that is playing out. This is why the Senate, one of many reasons why the Senate is so important, is that the Senate confirms federal judicial nominees. And I will only vote to confirm federal judges who pledge to uphold Roe v. Wade and defend the privacy of women's health care. And the bottom line is that it is not the role of politicians like Senator David Perdue to get in between a doctor like Alisha and a patient and make personal, private, complex healthcare decisions that need to be left to individual women. Here in Georgia, the state legislature passed HB 481, which was one of the most restrictive anti-abortion laws in the country. And their goal in doing that, by the way, it's now been stayed by a federal court, so it's not currently the law here. But their goal in doing that was to move it up through federal courts to try to overturn Roe v. Wade. I will be a champion for the privacy of women's health care here in Georgia. And one of the effects of this kind of legislation is that it deters OBGYN doctors from practicing medicine in Georgia when we already have a shortage of OBGYNs and we already have a maternal mortality crisis. And Alisha, maybe you could speak a little bit about maternal mortality, about how we can reduce maternal mortality in Georgia. What are the factors that drive maternal mortality or make women more likely to sustain injury or harm when they're pregnant or giving birth?
Yeah, so I think some of it we touched on already, and that's the pre-existing conditions, the hypertension, the diabetes, morbid obesity. All of these contribute to poor health outcomes and ultimately can lead to maternal mortality. So that, of course, expanding Medicaid and getting women access to healthcare is vitally important. And then, as you mentioned, we have a shortage of OBGYN doctors in the state. So it's really hard for pregnant women to access care. And that can also lead to poor maternal outcomes and maternal mortality when a woman has to travel hours to get to a hospital to treat her. And potentially treat her for something that is life-threatening. So I think certainly expanding access to care and encouraging doctors, OBGYNs, to come practice in Georgia and come practice throughout the state is incredibly important. And part of that is allowing physicians to practice and allow physicians to be able to make decisions with their patients, like you mentioned, without having politicians in the exam room.
Yeah, and when we talk about access, that's why two of the things that I'm most excited about championing in the Senate are, one, building more health clinics so that Georgia's women and Georgia families don't have to travel an hour or an hour and a half to get to a doctor. It is within our power and our resources to make sure that every single family in this state has access to healthcare conveniently. We should be building health clinics, for example, near our public schools so that families have easy access to primary care and preventative care, urgent care, mental health care services. And the other thing is to bring more doctors and nurses into the workforce, right? These are essential workers, and we have a shortage of medical professionals in Georgia. And by expanding the U.S. Public Health Service, not a lot of people know about the U.S. Public Health Service, but these are some of the most important healthcare professionals in the United States who provide care to underserved communities. We should expand the U.S. Public Health Service so that we're bringing more highly qualified doctors and nurses into the workforce, training, recruiting, deploying them to underserved communities so that every single Georgian can get access to the care they need because we have the facilities and we have the doctors and the nurses to treat people. All right, let's see, we are on Paul.
Paul from Gaines asks, what do we do if the ACA is overturned before you get sworn in?
Okay, Paul, I have news that I hope will relieve your concern a little bit. So here's what's happening right now. There is a lawsuit which my opponent, Senator Perdue, supports to overturn the Affordable Care Act and end its protections for people with pre-existing conditions. And the Supreme Court will be hearing oral arguments, right? So they'll start the debate effectively about that lawsuit on November 10th, just a few days after this election. But the Supreme Court will likely not rule on that case until next May or June. And by next May or June, the new Senate will have been sworn in. And so if the Supreme Court decides that it wants to pursue a partisan agenda, that it is going to overturn the Affordable Care Act and rule with insurance industries instead of defending the public interest and upholding the rule of law, if the Affordable Care Act is overturned, it will be the new Senate that makes decisions about how we respond to that to restore essential protections and make sure that Georgia families, and Paul, that you're not at risk of losing your health insurance because of a pre-existing condition. That, for example, the Medicaid expansion that's part of the Affordable Care Act is sustained and strengthened. and that Georgia accepts those Medicaid dollars so we can get more low-income people the care they need, so that we can get more resources to our hospitals.
All right. We have Anne from Decatur who asks, what are your strategies for saving Medicare, Medicaid, and Social Security?
Thank you, Anne, and hello to everybody in Decatur. And thank you for the question. So when we talk about Medicare and Social Security, I think the first and most important point that we always have to recognize is that American seniors have paid into these programs throughout their entire lives, right? These are not simply benefits that appear. These are investments that families have made, and they need to be able to count on their Social Security and their Medicare, which they've paid for throughout their lives, to be there for them. Our country made a decision almost a century ago that we would not allow our nation's seniors to be destitute or homeless or without health care in their elder years. And we need to live up to that promise. We need to make sure that every single senior gets those benefits that they've paid into throughout their entire lives. Right now, President Trump is pushing a plan to defund the Social Security Trust Fund by 2023. And my opponent, Senator Perdue, supports it. He would cut off the funding stream for Social Security such that it could not sustain its obligations to those seniors who have paid into Social Security their entire lives after 2023. That's wrong. We need to be strengthening Social Security. Think about who has been hit the hardest by this pandemic. It's been seniors. They're most at risk. Why, in the middle of a pandemic, when seniors are most at risk, would Donald Trump and David Perdue be undermining the resources available for Social Security? It's because they've wanted to cut Social Security and Medicare for decades. And my opponent has been a passionate advocate for reducing those benefits and cutting those programs. So I will defend Medicare and Social Security in the US Senate, and I will do everything I can to make sure that Georgia expands Medicaid for all the reasons that we've discussed. Looks like Dino has a question from Facebook Live. And remember, everybody, before you get there, I'm sorry, dear, if you have a question for either of us, just throw it in the chat or the comments. We'll try to get to it.
So Jon, do you have a plan on how to approach voter suppression?
Okay, Dino, thank you for the question. So voter suppression is a story as old as the South. And what we're seeing right now in Georgia, with people being made to wait 8 to 12 hours to vote, the way that county precincts, especially that serve Black voters, low-income voters, have been under-resourced, the way that the state of Georgia right now is failing to provide adequate technical capacity to our counties so that we can make sure everyone has a chance to vote without waiting for 6, 8, 10 hours. It's a travesty. Voter suppression is a betrayal of the basic principles of our democracy, which is that we all get to participate, we all get to vote. People sort of toss around the phrase or the expression, you know, your vote is your voice, to the point where we don't think about exactly what that means. Here's what that means. It means that voting is how each of us and our communities demand affordable health care. Voting is how we demand affordable housing. Voting is how we demand criminal justice reform. Voting is how we demand investment in infrastructure and schools that serve our communities. Voting is how we demand that our civil rights and our human rights and our right to privacy be upheld. And so when our own government systematically denies people their voting rights, that is an attack on the citizens themselves. This is why we need a new Voting Rights Act in honor of Congressman John Lewis, legislation that my opponent David Perdue refuses to support, which would restore and strengthen the Voting Rights Act. And I think we need to go further. We need to make voter suppression, it's just my view, we need to make voter suppression a federal crime.
All right, we have a question from Juanetta. What can we do as Georgians to combat the misinformation about coronavirus, especially since it greatly affects seniors and people of color?
Thank you for the question, Juanetta. So getting back to what we were discussing at the beginning, it's about empowering experts to communicate with the public directly, right? Like, remember when we had the President of the United States in the White House briefing room at the podium with the presidential seal on it on national television, literally suggesting that people inject chemical disinfectants to treat COVID-19, or speculating on live television that maybe doctors could shine bright lights into people's bodies to cure this virus. Donald Trump has no idea what he's talking about and no business advising the public on how we can protect ourselves from a virus like this, while his own medical experts are being marginalized and silenced because politicians are politicizing the response. So this is why it is so important that we have political leaders who put expertise front and center, who trust science, who recognize that the people who have dedicated their careers to fighting disease are the people who should be in charge when a deadly disease arrives. I don't know, Alisha, maybe you can reflect a little bit on, what those early weeks were like for doctors and healthcare professionals here, and what people need to know right now.
Yeah, so I think those first weeks were pretty scary because we just didn't know what we were up against yet. And I think we, instead of kind of attacking it with everything we had and fully engaging in PPE, we kind of had a slow scale up, which really set us behind. And now our hospital systems and the hospital systems in which I work have done a wonderful job of making sure we have proper PPE. But it was really scary those first weeks. And it was scary for our patients who were having to come to appointments alone because they couldn't have anyone with them. When they were coming in for labor and delivery or for surgery, again, alone. And that's really scary. And so that's what was happening in those early weeks. And luckily, we have been able to make some changes, and patients now can have a support person with them many times when they're admitted to the hospital. But it's still a scary time, and especially for our patients, although I think our healthcare workers have done an amazing job in working through this and in supporting our patients.
All right.
We have Antonio from Marietta, who is wondering, what are key factors in a stimulus bill that you would support?
Yeah, so Antonio, thank you for the question. And look at what's happened in the last few months, right? The PPE small business lending program that expired in August when the Senate was on vacation. And only now, only this week, are they potentially getting into session to reauthorize that program. The emergency unemployment insurance expired in August. They haven't renewed it. Every day, the federal government is providing huge subsidies and huge relief and huge support to huge investment banks and major corporations through the Federal Reserve, literally every day. But when it's the mechanic on the corner, the mom and pop small business, the local cafe, I mean, let's talk about who's really struggling right now economically. It's not Senator David Perdue's high dollar donors. It's ordinary people. And it's those same ordinary people who are being denied relief. When we have a crisis like this, the economic response, in my opinion, should prioritize people who need help most. And that's regular working families, small businesses. But instead, so often, just like we saw in 2007, 2008, during that financial crisis, it's the powerful and well-connected who get the most help. So what I'd like to see in further economic relief measures is more direct support for workers and working families, more direct support for small businesses. They should be the priority. Direct support for school districts that still haven't gotten federal help to meet public health guidelines and to reopen safely or to engage in remote learning. Childcare credits to help working families and especially working moms get their kids into childcare if local school districts are still closed or only providing limited in-person learning. The economic response should be focused on making life easier for ordinary people. And we need leaders in Washington who put the interests of ordinary working people ahead of the interests of lobbyists, ahead of the interests of powerful trade groups. Thanks for the question, Antonio. We have one from Mary.
Mary from Stone Mountain says, many students, including myself, are expecting to graduate soon from college. With the current pandemic and unsteady economy, it may be challenging to find a job post-graduation. Do either of you have any advice, reassuring messages for these students who may be seeking a job in our current climate?
Yeah, that's a great question, Mary. And it's related to Antonio's question, and a big part of why we need economic relief that helps ordinary people, that helps all of those who are now having their plans and their careers interrupted because of this crisis. Let's also step back and in answering Mary's question and recognize that one of the reasons that the economic crisis has been so much deeper has been because of the failed public health response. A government that is responding properly to this pandemic, controlling the virus, empowering medical experts, is going to put our economy in a position to recover faster. So, Mary, we've got to empower public health experts to get the virus under control so that we can return to normalcy. And then you can continue with your plans that you had and not have them interrupted and be in this period of limbo and uncertainty for so long. But we're also going to have to jumpstart the economy, right? Like in answering Antonio's question about a stimulus bill and about economic relief, that's really about short-term help for people who are having trouble making ends meet right now, whether it's a small business that's on the brink of insolvency and can't get a loan, thinking about having to lay off employees, or a working family where one of two parents has been laid off. And so they're trying to struggle to figure out how they can afford healthcare that the family needs and make the house payment. That's the short-term relief that we need. The long-term economic recovery plan has to be about jumpstarting the economy and creating jobs in the long term. And that's where we need an ambitious infrastructure and clean energy program that will create millions of jobs across the country. We've needed an infrastructure plan for more than a decade, right? These are already overdue investments. And I remember when Donald Trump was running for president, he was talking like he wanted to pass some kind of ambitious infrastructure program. It's actually probably the kind of thing that he could have built bipartisan support for. I remember sitting down and talking to Congressman John Lewis in the early months of the Trump presidency. And Congressman Lewis was saying, hey, he thought we probably would actually get something done on infrastructure, bipartisan. But it hasn't even been on the president's agenda. We need an ambitious infrastructure plan now more than ever to get people back to work. And Mary, what that will mean for you is that there will be increased demand for goods and services that are made here in America. There will be businesses that are thriving because we're investing in things like clean energy and rural broadband, technology, research and development to get the economy moving again, to restore America's place in the world as the leading innovator, to invest in sustainability and economic growth. So I think we have time for one more question. And I'm going to read this question. This is a question from Amy on Facebook. And Amy, thank you for tuning in. So Amy asks, as Alisha knows, there is a lot of inequality in our healthcare system. What can be done to fix it? And I wonder, Alisha, if you could reflect on the kinds of experiences and struggles that you see from patients you treat, especially low-income women, people who have been neglected access to services and care, and what your perspective is on inequality in healthcare.
Yeah, Amy, I'm so glad you asked this question because it is so important. We talk a lot within the field about racism in medicine and how real and how devastating that is. We know in Georgia and across the country, Black maternal mortality is 3 to 4 times higher than that for white women. And that is heartbreaking and it is unacceptable. And that is nothing new. We have had those stark differences for decades and have seen no improvement. And I'm hoping that now we have increased awareness to this issue. It is something certainly that we in the hospital are focusing on very acutely. And we just need to continue to raise awareness, to check our own inherent biases, because it's a question of lives, it's a question of women's lives, and it is unacceptable, and we need to be doing better.
Yeah, and I'll add, Amy, this is about just the most fundamental thing, the most important thing in all of our lives, which is our health. And we are the wealthiest country in the world. We have the resources, and we have the brilliant doctors, and we have the technology, and we have the public will to make sure everyone has great healthcare. Getting every American great healthcare is a popular position. This is what the American people want. The issue isn't a lack of will by the people. The issue is that there are very, very powerful industries with a lot of political power who are standing in the way of making healthcare affordable for every community, regardless of wealth, regardless of race. And we have to break the link between health and wealth. Good health is something that we should expect and feel is assured to us because we live in a country that has the resources and the expertise to make sure that we all have great health care. And I really believe that when we win these elections, we get this virus under control by empowering experts like Alisha. We dig out from the rubble of what this administration's destroyed. We reunite Americans and provide a shared vision for where we're headed, right? This politics by division and pitting people against one another constantly, it's just so counterproductive. It's corrosive to our national soul. It's taken a huge toll on all of us. It's made it so much more difficult to confront this crisis. A crisis like COVID-19 should be unifying. We should be seeing past our differences right now because we have a common goal, which is to defeat this virus. When we bring this country back together to defeat this virus, we can also bring this country together to make sure that every single American, every single Georgian has the health care they need without breaking the bank, without having to stay up at night because of anxiety about whether we can afford our care, whether a bad diagnosis could bankrupt us. That's where we're headed. But in order to get there, we do have to win. And so I'll just close it out by encouraging everybody to make a plan to vote and vote early. I'm going to ask my team to throw voting information up on the screen. Please, y'all, don't put this off until November 3rd. That's just the last day to vote. Don't even think of it as election day. That's just your last chance to vote. We need to get this done. And to avoid those long lines that could emerge on election day, and to make sure that your vote is counted and to get it taken care of, make a plan to vote early. Go to electjon.com/vote to get all the information you need. Alisha, thank you so much for joining. And thank you all for tuning in. Much love to you. Good health to you and your families. Thanks.